for our customers. We have some videos. We're also happy, like if you give us a call or email us, we'll provide additional training to your team. We're going to do it online with a live person. If you feel like you weren't using our software to the fullest, and let me just say something, no one is using any software to the fullest. It's, you know, 80-20 rule. 80% of the value is going to come from 20% of the features. The software is written to accommodate different offices that function differently.
People don't even use all the Snapchat filters, so nobody's using everything 100%. You kidding?
Yeah, you know, totally. Like totally. Snapchat filters is a perfect example. But but yeah, but you can use it better. So this is the time to train your team. They could be training remotely. The other thing you could be doing is you could be, if you know, this is the time to write your standard operating procedures. I am the one, you know, flying around the country talking about the need to have standard operating procedures. I have a course. It's a free course on the Dental Success Network. If you're a member of it, I'm one of the faculty on the Dental Success Network. There's a free course for members where I talk about creating SOPs. That's another resource.
Do you have it available outside of DSN?
No, I don't, but I'm happy to put together, if anyone is interested, I'm happy to put together a webinar maybe for next week sometime on how to create SOPs. The nice thing about SOPs is that it puts everyone on the same page, because, you know, we have a limited number of situations that can happen in a dental office. Obviously, what's happening right now is, you know, is unheard of before, and hopefully will never happen again. But what normally happens in a dental office happens to everyone every single day. And every time we have a situation, it's like we're solving it from the beginning. You know, it's like, oh, what do we do with Mrs. Smith who has a balance? Or what do we do with, you know, this review? Or how do we approach this? When you start creating SOPs, you standardize your procedures. You put, you know, a lot of offices have this conflict between the front office and the back office. And that's very sad. But the reason it happens is because we, you know, as a front office employee, we have different optics on the same situation as a back office employee. You know, I'll give you an example. Let's say a patient is running late, right? And then they call me at the front office and they'll say, I need to reschedule my appointment, or I'm going to be 15 minutes late, which happens a lot to me. I'm in LA. Traffic in LA is not measured in distances. It's measured in minutes, because one day, or one time of the day, certain time of the day, it could take 15 minutes to get somewhere, and then 2 hours later, same commute will take you an hour and a half. You know, like you never know. So you know, have patients calling in saying they're going to be running late is normal, and then the front office is trying to accommodate that patient, and maybe the patient is upset or angry, or they're stressed out, they're driving, they're working so hard filling that schedule, and they're juggling a million of other things. Whereas back office is like, but that's putting us behind. The hygienist is upset because she has only so much time, and then she has to wait for the doctor. The assistant has to, you know, she's running between multiple rooms. Communication is not the greatest in a lot of offices, unfortunately, because all of us are in the mouth. It's difficult to communicate, which is one of the reasons why we even came out with the communication part of our software years ago. Is to really facilitate intra-office communication. But the point is, we have different members of the team have different optics on the same situation. But if we as business owners create an SOP, a standard operating procedure for each single situation that can arise, like what do you do if a patient is running late? And then you kind of stipulate, and again, I'm happy to share a sample of like what it would look like in my office to have that type of an SOP for patients who are running late. But if we have that SOP, that sort of unites back and front. Now, everyone in the office knows what is the official way of handling a situation. And everyone understands why you handle this way. So this is a good opportunity to, you know, get some job descriptions written up. A lot of offices, every time I lecture, every single time, I ask the same question. Raise your hand if your office has written job descriptions. And it's usually less than 5% of the room that raises their hand. And they should have job descriptions. How often? I always tell doctors, I know there are a lot of team members on this call. I don't want to throw my colleagues under the bus, but unfortunately, a lot of times we don't create expectations for our teams very well. And one of the things that I lecture about is is creating expectations and making sure that our team has clarity about what do we expect, what success is going to look like when we get there. Because a lot of times it's like, okay, keep your schedule productive. But what does that mean? My definition of productive schedule could be different from my assistants, from my hygienist, or from my front office. And if everyone is doing their own thing, and then as a dentist, I come in and I see like, oh, I have 2-hour hole in my schedule, and I blow a fuse because, I'm losing
it's
money.
2 hours.
It's 2 hours.